The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, and thank you for joining us for today's webinar on MyLourie. And thank you for taking the time out of your busy day, especially as we approach the busy AEP season. We've got a little treat for you today, and we're going to do a quick overview on MyLourie. We're going to talk about how to get registered, some features, what it is, how to use it, and then we'll do a brief demonstration on MyLourie, how to do an enrollment in person and then virtually. This whole webinar should not take too long, somewhere around 30 minutes or so. And if you see on your GoToMeeting control panel, there is a section where you can ask questions. Please do not hesitate to ask questions. We'll pause in the middle and then we'll pause again at the end. My name is David Goldberg, Agency Director with Lurie Life and Health, and we've got a special guest near me today. You may know him as Joel Lurie, President and CEO. So with that in mind, we'll get started. All right, so MyLourie, we've talked about it. Everybody's talking about doing doing electronic applications. What is MyLourie? Well, it's really an all-in-one enrollment tool for both Medicare and the ACA. We're going to focus on Medicare today. We'll have a separate webinar on doing ACA enrollments as the ACA open enrollment period draws a little bit closer. You can efficiently write business however you want, right? Whether you're in person or if you want to do it over the phone. You can manage your client data using MyLourie's CRM portal. This is a great portal which allows you to plug in as much or as little information as you want. You'll be able to compare Medicare Advantage and prescription drug plan options based on your client's providers and or prescriptions. The provider piece will be coming out before the AEP rolls out. We'll talk briefly about that. And then market to your book of business. So this will allow you to download your book of business reports. I will stress, just like anything, data is only as good as the information that's being plugged in. So when you're plugging your information in, make sure it's accurate, spelled correctly, the spacing is correct, and we'll talk about that a little bit more. So why use MyLourie? Well, I mean, first of all, it's 100% paperless. So it's electronic applications. You know, you've heard carriers say this. 20 years ago, it was almost all paper applications. A few years back, carriers were transitioning to e-apps. It removes clutter. It removes pending application or decreases pending applications. The benefit of MyLourie is it's just one portal. Instead of having to learn 5 different portals from 5 different carriers, okay, it's just one portal. Eliminate that clutter and errors, reduce your pending applications. Again, it's a CRM, so it creates a paperless file for each client, and whatever data you have plugged in will pre-populate on the application based on what you've already entered. Okay. There is a new feature coming out, and that will be the ability to do virtual enrollments. So the virtual enrollment piece has a connect feature it's actually built into the portal. You will have to request it, and we'll send something out a little bit later on today where you can request it. All right. You can do it all over the phone, sight unseen. If you're doing an enrollment virtually, it has to be done from an incoming call. We'll show you how to do that. You'll be assigned your own phone number. It's recorded, and then you need to save it. It is an office in a box, so you can do texting. You can do screen shares, kind of like what we're doing right now, GoToMeeting, right, where you do a screen share with the client. There is a great benefit to that. And the cost to it is $20 a month. Now, that cost will be waived if you submit at least 10 applications through MyLourie. So 10 Medicare Advantage applications. They don't necessarily have to be done virtually, but if you're submitting 10 applications, we'll waive that cost for you. Otherwise, it's going to be $20 a month. So, all right, let's talk about how to obtain access to this. Well, you've got to have at least 3 carrier contracts with us on the Medicare side. Okay, then you'd want to reach out to us. You can email us or you can give us a call at 800-807-8784. You'll need to create what's called a Sure LC profile. That takes just a couple minutes. It's just the backbone for MyLourie. And then give us a couple days to get your portal created. Now, let's look at the carriers, and then we're going to do a brief demonstration on how to do this. So what carriers can you write through MyLourie? Well, most of your major carriers. So if you look on the left side, you'll see the carriers. If you look in the middle, you have the ability to quote everybody. Everything that's listed with a Y, you can enroll in person. And then with an asterisk, you'll see the virtual enrollment. Note that there is one major carrier which allows in-person enrollments, but not virtual enrollments, and that is United Healthcare. And then on the far right, you will see that the scope of appointment requirements. You can do a scope of appointment within MyLourie, or you can keep your own scope of appointment on file, and you can even upload it into the client's file. The one carrier that requires you to do it as part of the application, even if you've done a paper scope, is WellCare. You'll see that at the bottom, and we'll go into how to do that. All right, so let's take a look now and do an actual an enrollment. All right, so what you'll see here is the login screen to MyLourie. Everybody will see the same screen here. You'll have your own username and password. Once you log in, you will see a couple things on your dashboard. You'll see your enrollments by month, breakdown if you do ACA and or Medicare Advantage, and then you can also break it down by carrier and by county. All right, so for all intents and purposes, we're going to create a new client for this. So from your dashboard, you'll have some options you'll be able to quote quickly, Medicare and or ACA. You'll see it from here. If you click on quote and enroll, it'll give you the option to find an existing client, or you can add a new client. You can view your client list as well, and you can sort some things and find reports, download reports through there. You can create tasks for yourself, reminders, and then there are some other benefits and features that are on here. So for all intents and purposes, all right, you've met with a client, you've got a client next to you, you want to go enroll them in a plan, all right? You would want to add a client if they're not already an existing client. So we're just going to add a client here, and we're going to use Joel as a test. So Joel will be his first name and Test will be his last name. Last we checked. All right. Let's see here. Joel's birthday is 10/10/1956. So you just plug in your client's identifying information. For the phone number here, we'll just put our office number. And then again, you can put as much or as little information in here as possible. So just populate this. And once you plug in the zip code, you'll see that the city and the state and the county automatically plug in. If there are multiple counties, you'll just have to choose the right county. For the mailing address, you can choose different. You can choose a different, or you can just click same as residential. Household and personal information is just for ACA. Again, you can put as much or as little information in here as possible. Same thing with the employer. Now, for the medical info, you can put in their Medicare card, and it will transpose all of this over to the application. So with that in mind, we're just going to leave that blank for now, but we'll just put in a start date of 10/01/2021 because Joel is turning 65 in this particular application. So don't need to know his primary hospital, pets. All right, if you're in a client's home and you see lots of pictures of Fluffy on there, just you can give yourself some reminders so when you call that client, you can remember things to help you remember them by. So let's throw in a couple prescriptions on here. Let's go with amlodipine. So what you can do, amlodipine, Veslate. There we go. You can take in it'll give you the options. It's kind of like Medicare.gov, where it'll show you exactly, it'll pre-fill the popular prescriptions. Let's throw in another prescription on there. Let's take the lisinopril. And just put the frequency on there. And then let's throw, Joel's got some heartburn here, so let's throw some omeprazole on there as well.
Only from working with you, David.
All right, so what you can also do is throw in, you can throw in a pharmacy. Let's say Joel goes to Kroger to pick up his medications. So you can see lots of different options here. We're just going to go ahead and select Kroger and save that as his selection here. All right, so now we've got Joel's information entered in, all right, or your client in your case, right? So what you'd want to do is hit Save Client. And now from that, on the upper right-hand corner, you'll see a hamburger menu, and you click on that, and you've got a few different options, all right? So what you can do is you can do a scope of appointment with Joel directly right now, or if you've got a paper scope and you just want to enroll in a plan, you can hit Select a Plan, okay? And then, so if we're going to do a scope of appointment, one thing you will see that will be added prior to the 15th is an option to do a text to scope. So you'll see that right before we do the enrollment. There will be another option added on there. So let's select a plan. Let's say Joel's going to look at a Medicare Advantage plan with a 10/1 start date. You just start quote. It's all intuitive. All right. Joel does not get any extra help for all intents and purposes for here. This doesn't matter. We'll just select Fair Health. Okay. And what you'll see now on the next page is on the left-hand side, you'll see the client's profile, pharmacies, prescriptions, etc. You can sort as well by carrier or unfilter or filter out some carriers. On the right-hand side, you'll see a list of the Medicare Advantage plans. You can, if we scroll down, it's going to sort them based on the estimated annual cost, right? What you can see here is, as we keep scrolling down, you'll see these costs increase. And a lot of these may be attributed to the premium, the monthly premium that's on there. So one other thing you'll see on the right-hand side is you should have a green button and a blue button, all right? If you have this particular carrier through us and you're contracted and certified, ready to sell, you will have a green enroll button. If you don't, it will be gray. And if you use the blue button, that'll take you directly to that carrier's website. So this would take us directly to WellCare's website to try and do an enrollment, okay? So Joel and I have decided, that Humana is a good fit for him. So what you can do, if you want to get a breakdown, you can just check the box on the left. All right, let's kind of compare a couple different plans. Let's compare Humana and Aetna and just hit this blue Compare Plans button. It will actually show you a side-by-side comparison, give you all of the information on the plan. As you scroll down, you can see that most of these plans, or on both of these plans, most of these drugs are tier 1. Aetna has omeprazole listed as tier 2. And then just underneath it, you'll see important plan documents, such as the summary benefits, star ratings, etc., things that may be required on an appointment. You can take a link straight there. We'll just click Humana's for this, and it takes you directly to your summary benefits for that Humana plan. So it's all right there at your fingertips. All right. Hold on one second. Looks like we've got a couple of questions that have come in. Hold on. Let's just take a look here. Navdeep says, is Medicare.gov still the best way to compare the plans? Well, Navdeep, good question there. You can do it through Medicare.gov or you can do it through here. I like the fact that Medicare.gov gives a little bit more information as far as breakdowns by month. This would allow you to this allows you to record your client's information without them having to create an account. So it's completely up to you, right? It's completely up to you. I personally prefer Medicare.gov just from my history, but either one works. All right. Let's just see here. Shelly asks, does the algorithm work as well as Medicare.gov to select the most cost-effective plans? It does. What it does is Medicare.gov they basically derive their information from the same source. But the information that you see on Medicare.gov is a little bit more. you have a little bit more information on there. So there's no, as far as co-pays, monthly costs, etc. A little bit more of a breakdown on there. Mike asks, I noticed that it's not showing SNP plans. How do I see them? Mike, good question. The SNP plans, you will see your D-SNP plans if you plug in that the client gets Medicaid. By default, it does not show the Medicaid, the D-SNP options on there. But as far as C-SNP plans go, those are the enrollments. Those are the one type of enrollment that you can't currently do at this point in time, but that will be lifted hopefully sooner rather than later. So, all right. And then can you import the RX list from Medicare.gov? Medicare.gov, you can. There is a link in the client profile to do a blue button import. In order to do that, Shelley, you have got to have the client has to have a Medicare.gov account. So, Mike is also asking, do the documents now show for Blue Cross Blue Shield? We are working to get that resolved immediately so that you will see everything on there. Thanks, Mike. All right, with that in mind, let's continue. So over here on our side, all right, so Joel has decided he wants to go with this Humana plan. So at this point, you can just hit enroll. There's an attestation you will have to agree to. It says right here, if it's a virtual enrollment, it's completed via an inbound call, confirm and proceed. All right, so right here, you have the option to either skip the scope if you've done a paper scope. If you're doing this in person, you just choose in-person scope. You have the option for a virtual email, which it sends directly to them after it sends it to you. And then the other option is SMS. That will be up and running in about 2 weeks. So we're going to do an in-person scope. All right. So we're going to start the scope of appointment. So Joel is doing a scope. One thing it does make you do is the agent has to put their information in. You'll see that this intuitively will add your signature and so forth, give you some shortcuts. So a little box pops up. It's very self-explanatory. Plug in your agent name. Fill out your fields. And then when you click on signature, you can either draw in a signature, or for the scope of appointment, you can also type it in. If you have one saved, it'll automatically save it. It's much prettier than mine would normally be. And then in this case, we'll put and then next, I agree. So again, if you're in person, the agent signs, and then you give it to the client to sign. So at this point, they would choose their scope. Right here at the top, you'll see it has click to initial. You just click that, and they can either draw in their initials, or it's got, since Joel's already a client, populated in here, JT, and you can insert it in a box, or you just hit insert everywhere, and it shortcuts it and puts everything down. Hit signature. And just make sure too that the client is the one doing that. So if you're doing this on an iPad, that they're the ones that have the iPad in their hands, or if you're doing it on your computer, they're the ones that need to initiate. Once you're done, you continue, and I agree. All right. Once that's done, I press continue to enrollment, and it's very self-explanatory at this point. Everything that we plugged in is now going to be showing on the application. So we're just going to have to enter in a Medicare number for Joel that he doesn't have yet for another 10 years. So let's see what we can find. Joel, for the time being, is going to be John Smith. So John Smith has a Medicare number of okay. All right, you just make sure these fields are correct. This is a PPO plan. HMO plans will require a PCP ID on there, so make sure you get that from the carrier. PPOs do not require it. Save and continue. All right, this is Joel's IEP. You do have to answer these questions here. And then sure. Most of these you can skip. They're already pre-filled out, but the ones that do have asterisks, you are required to complete. You're required to complete. And then Joel, how do you want to pay for your $0 premium? Let's just say Joel chooses coupon book. And this is the statement of understanding, the legal disclaimer. So you do need to go over this. Each carrier has this. I mean, it is something. And when we'll talk about it more in the virtual, you are going to be required to read this verbatim. So, and then at the bottom, you attest to the agreement. Since Joel is enrolling himself, he doesn't have a power of attorney. And then you just click on the signature. And the client, Joel in this case, would sign his name, right? So, yeah, this is a major change from last year. Okay, so in the past you had been able to type it in, but per CMS guidelines, it now requires a signature. And if you have a touch screen, I would just let your client sign on the touch screen. If not, technically they can use the mouse. All right, so we're going to insert that here, whatever language they want. Make sure underneath when you're doing the plan selection review that they are enrolling in the correct plan. Okay, there are a lot of plans that look similar. You need to make sure 100%, double check, triple check that this is the correct plan. I've seen agents where they thought they were enrolling somebody in one plan, but when they got here, they saw it was a completely different plan. Just double check. You're just literally, at this point, you're pretty much done. You confirm, put in face to face, and then for the ID number for the schedule appointment, hit generic. Now you'll see that submit button is pulsing. You can hit submit. I will not submit it now because this is a live application, but that is, that's it. That's it. Similar situation for other carriers as well. So this is an in-person application. And now what we're going to do is we're going to do a brief virtual application. So what we'll do is we'll back out of here. So let's say Joel wants to enroll in this very same Humana plan, but he wants to do it virtually. Okay. At this point, so this is just asking about a scope. If you want to do a virtual scope, it will send them an email. It'll send you an email first. You'll have to fill out, remember the agent has to fill out their portion first. Once you fill out your portion, the client will receive an email to finish the scope of appointment. All right. And then just as a reminder, right before the AEP goes live, you should see a text to scope feature on there. So we're just going to hit skip the scope. How are you doing this enrollment, right? We'll just choose virtual at this point. So nothing has changed. Joel's information is still the same as it is before. It looks just like the exact same application. Let's plug Joel's Medicare number back in. Remember, if we had this on his profile, it would automatically carry over. Makes it much easier in future years when if somebody has to change plans because of some unknown reason. All right. Again, IEP, these same questions. How does Joel want to pay for this? Now, at this point, all right, you've done the presentation with the client. You would then have to say, all right, Mr. Client, all right, Joel, at this point, we need to hang up and I need you to call me on a separate number. Okay, and then I can do the rest of this virtually. All right. So Joel and I would hang up, or you and your client would hang up. You would at that point go to the option that says connect here. This again will have to be enabled. All right. So you click connect. Okay. It will give you a phone number here. All right. This is a phone number where you can take outbound calls, you can do text messages, but if you want to receive an inbound call, you need to click on the settings option. You may get an error message, and if that's okay, just hit back to log in. All right, so at this point, you've got the same options here. You can make a call, but you can also receive an incoming call. And so you would give your client that call, that phone number. They would call in, and you're basically talking through your computer as if, we're doing a webinar, you're doing a Zoom, right? You're not on the phone, you're talking through your computer, and you would say, Mr. Joel Lurie, all right, it's your intent to enroll in this Humana Choice, PPO plan H5216-210. Joel would say yes, or your client would say yes. Say, all right, let's go over, the statement of understanding. You would read this 100% verbatim, okay, and then make sure that the client agrees to everything. Still the same attestation. Everything's the same with the exception of the signature. Okay. Once you've done that, say, all right, Joel, this is a binding signature here. With your permission, I'll go ahead and type in your signature. And Joel says, yep. So we'll insert that. Nothing else changes down here. You still put in your information, hit I confirm this is my writing number, and hit submit. And so really, the only difference between an in-person and a virtual enrollment is you have to have an inbound phone call for that enrollment process to take place virtually. And it automatically records the phone call for you. So you can then download that recording. It'll be archived. You can download it from the client's profile. It actually gives you a portion. There's a link where you can upload a file, whether it's a scope of appointment, whether it's a piece of paper, whether it's a multimedia file. It's going to give you that option in there. All right, so with that in mind, we've got quite a few questions. Hold on, Jane Muldrow, great to see you. Hi. Okay, yep, the question about C-SNPs was answered. Navdeep, yeah, I know there was a little bit of an issue with my screen being frozen. I really appreciate that. Shelly's good. Mike, you're good. All right, LaShawn, what if you are doing virtual? Can you send a scope and get a signature? Yes, LaShawn. So I'm glad you asked that. You can do it via email or you can do an SMS. Jane, but what happens over the phone enrollment? I hope I answered that question for you. Navdeep, can we do a virtual scope from this portal or do we have to go in the Medicare supplement portal? Navdeep, you can do it through this portal or you can use the other one. I find it now, it might be easier just to do it in one portal. We have another portal to quote Medicare supplements, which you can do it that way, whatever's easier for you and your client. So now, do you have to read that whole page? Yes, you do need to read that whole page, right? Sentence by sentence. You don't want to speed read through it. But I mean, again, it's the ability to do everything virtually. Yes. Jane, can we do the whole interview over the phone? Yes, you can do the whole. Are you talking about the whole, like going over the plan, going over the options, etc., over the recorded phone call, or are you talking about doing it on your own phone and then switching it to the recorded phone call at the end to do the enrollment? Because you can do it either way, whatever works for you. Again, in the event of a complaint, you want to make sure too that you've got your bases covered. Yep, Jane, that is correct. You can do the whole thing either way. Shelley, does the consumer have to have a computer for virtual? No, they don't. They can do it on their phone or their iPad as far as the scope of appointment goes. And then, so they don't need to have a computer per se for that. And as long as they've got a phone to dial into your existing phone number, it's easy as can be. You don't have to worry about that. All right, with another question, does a scope of appointment work the same way as another portal? The consumer receives an email from my email address with a link. So here's how it works, Shelley. When you do a virtual scope, it's going to send you an email and the client an email. You're going to get an email to complete the scope, and then the client will get an email saying that there will be a scope on the way. Once you complete the scope, the client receives the email saying, hey, the agent's already completed the scope. Now you complete your portion, right? So then they would open it up. They would initial the boxes, sign, and then they would once they complete it, you'll get notification via email that they have completed the scope. Jane, I love this. Well, we appreciate it too. We're trying to make it as easy as possible. Thank you. Thank you. LaShonda, let's see. How do I set up a MyLourie account? That's great. Do me a favor. Give us a call here. Okay, we're going to send out something afterwards. You'll see something hopefully by the end of the day. And if you want to request a MyLourie account and you already have a Sure LC account, we can have that done. Just give us a couple business days. Okay. Shelly, lots of good questions here. Do you have the sending address for the email that goes to the client? Sometimes I have to help them find it. Yeah, Shelly, it is. It's a separate email address. It's not like it's directly from you. So it may end up in spam if their spam filters are strong, but I don't believe. I mean, the first couple, it's through HelloSign is who they use. HelloSign, so is what MyLourie uses. Joe, I can do Blue Cross if you're licensed there. Joe, yes. All right. Navdeep, I think I answered your question. And can the steps to the virtual call be written? Yes, we can do that for you. So, and then, yeah. Yeah, and we have some short snippet, like 30-second to a minute and a half, quick training videos. So Jane, last question. If virtual, do we always sign the final signature page with their permission, or can they sign it? Well, remember, if you're doing it virtually, that's assuming the client's not there in front of you, right? So yes, you would need to get their permission to sign that, right? So I'd say, Jane, all right, we've read over this. It's your intent to enroll in this Humana H5216-210 plan. This is a PPO in Richland County. Do you give me permission to go ahead and type your name in as a signature? And then you would say yes. Okay. Andrea, great to hear from you. How do we get a Connect phone number? You let us know. Again, we'll send you out some information. Get in contact with us here at the office, and we'll take care of it for you. So, all right, a couple other people asking the same question. Again, like I said, we're going to send an email out within 24 hours. And for those that want to sign up, they can. And as long as you write 10 or more apps through the portal, that $20 monthly access fee will be waived. So you don't have to worry about that. So. Joel, hey, Joel, Jane's now asking, yes, Jane. Jane is wondering if you can teach her how to use a computer. Can you do that?
Be glad to teach her how to turn it on.
That's right. Good at pushing buttons. So, all right, guys. Keith, we'll talk offline about trying to get that. And Navdeep, as far as getting a Connect phone number, that happens very, very quickly. So, and no past enrollments do not count. So, with that in mind, thank you guys for being on today's webinar. Again, we'll have some snippets to send out, and everybody will receive an email within 24 hours. You can contact us at Lurie Life and Health, and we'll be doing a separate webinar when it comes time to talk about doing ACA enrollments. Thank you, guys. Great to see everybody. That concludes today's webinar. Happy AEP.